Hi, I'm Colin Hung with Healthcare IT Today, and I'm excited to sit down with these two gentlemen to talk about COVID vaccine inequities. Today, I am joined by Michael O'Neill, CEO and founder of GetWell Networks, and Royal Tuthill, co-founder and president of Docent Health. Thank you, gentlemen, for joining me today.
Hey, thanks for having us.
So, Michael, I want to start by asking you a question. We've heard the phrase vaccine inequities and unequal vaccine distribution bantered around the media recently. What do those terms mean to you, and how would you define them for us?
Well, I guess, first, look, COVID-19 has affected all of us, right? But it has not impacted all of us equally. We've learned pretty profoundly that while race is not a risk factor for COVID-19, certainly structural racism, health inequities, food insecurities, these things have had a pretty significant impact on health outcomes for many, many things, but certainly for COVID-19, And so while the exposure to the pandemic has been the same for all of us, the mortality rates of Black populations, Latinx populations are twice that of white Americans. So I guess I'd start by saying that this has certainly brought to the surface and exacerbated these things. And so when it comes to vaccines, I would just simply say we're starting to see the same thing play out, unfortunately. Take a state like Delaware, where you're just starting to see reports from states, right? And so while 8% of the vaccines that have been distributed in the month of January went to Black Americans, 24% of the cases, 23% of the deaths are actually with Black Americans. And so this is just an example of, I think how profound, this is. That's how we would define it. And we think we have a big opportunity that technology can bridge this, and so it's one of the reasons that we partnered up with Royal and the team from Docent Health, and love him just to comment on some of the work that they've done, because it's so important to what we're actually after right now.
Yeah, I want to dive into that, but Ro, maybe I can ask you first, why do you think it's so important to address these inequities, other than sort of the moral reason why we need to address these?
Yeah, well, I think Michael spoke to some pretty significant stats. We won't get to the levels that we need to just in terms of vaccination and protection against COVID-19 if we aren't addressing all communities equally. And it's super important that we don't just look at the macro level statistics, that we really drill down and see how are we vaccinating particular communities at a more granular, at a sort of neighborhood and zip code level, because there are high sort of skepticism around the vaccine and around healthcare institutions in general for certain communities, particularly African-American populations. And if we don't figure out how we can address that, support them, build trust, get shots in arms in those communities, we're going to have really devastating impacts for years to come if we can't make sure that we address this on a really sort of localized level.
Yeah, I mean, it's sort of the truth of this unfortunate pandemic is that, it does us no good to have one neighborhood vaccinated and the neighborhood next door not, right? I mean, the virus is just going to continue to spread. So, we have to make it sure that the vaccine is distributed equally.
Colin, you asked an interesting question around beyond the moral question around this, where's the impact when these inequities continue? And I'd say look, first of all, as we're all feeling, this pandemic is tearing at the fabric of our society. You can't be together. You can't be with family and friends. And so there's a social impact that is pretty dramatic, and quite troubling, and the toll it's actually taking. But also on the economic side, hey, look, when we don't take care of folks in an equitable fashion, the economic toll that we can't fund other programs that actually are needed in society. So I think, your question is a really good one. It certainly goes well beyond. There is a moral issue that's a very important one, but it certainly goes well beyond that when it comes to vaccine inequity and our ability to kind of take care of this the right way.
And I like the way you put that, Michael, because I mean, yes, we should, just on a moral basis, we should do this. But, let's be real. When it hits the pocketbook, when it hits society as a whole, when it hits our inability to recover from this pandemic, I mean, that's where I think people go, oh, okay, yeah, we really need to do this.
Yeah.
And I'm glad that we're finally realizing that, hey, we got to help everyone here. We got to lift the entire boat, all boats with this. Otherwise, we will take a lot longer than we are hoping. So, Roel, let me ask you. So, what are you doing to address this issue? Michael sort of alluded to that earlier.
Yeah, I mean, so first and foremost, we're working with health systems and we're working with our payer partners to make sure that we are getting the communications out there and getting that effectively. So one, they have to get the vaccines. Two, they've got to make sure they have the infrastructure to deliver the vaccines. We're really helping them to drive the communication, to drive awareness, and doing that both, we leverage SMS texting to make sure that we can communicate with people the tools that they have in their pocket today to understand, are they eligible for the vaccine, updating them on when it's becoming available, getting them connected to the right resources. And then for certain communities, particularly African-American communities and Latinx, that there's higher levels of skepticism, we're actually putting virtual boots on the ground in those neighborhoods, people that we are hiring from the neighborhoods that can connect with empathy, that can connect with cultural relevancy to overcome some of the trust and build advocacy and help communicate and educate why this is really important. So it's a combination of high tech, broad scale, as well as human to human conversations that's going to build advocacy.
That sounds amazing. I have two questions there. That sounds amazing, by the way. The people that you are bringing in to be your super users or your advocates, if you will, for the vaccine in the communities, how are you finding them?
Yeah, I mean, we're working with our partners. Common Spirit's a great example. They're across 22 states across the nation, a huge commitment to health equities from the board and the CEO on down. Docent's had a model since we started for the last 5 years of hiring locally from the communities to help serve vulnerable populations. So it's a process that we've built out and really refined to make sure that we can find advocates in the communities that we can empower with technology to help scale them and engage. And so it's kind of continuing that process and rolling it out kind of community by community.
And you mentioned SMS texting. Is there any pattern or any type of wording or anything that you're finding is really effective right now to get that message out there?
Yeah, and one of the things we're doing is just making sure that the language that we're using through texting is very human, it's very personal, but it's at the appropriate reading level for the communities that we're engaging in. And then Michael, I know we're doing a lot of work with GetWellNetwork around the content and a huge repository of information and content that they have and messaging, and working with subject matter experts to make sure that it's tuned for the communities that we're trying to engage.
Yeah, we've learned so much in this. At GetWell, as we were finding our way to Royal and the work that they were doing and figuring out how and why we should kind of join forces, there's this combination of this SMS-based outreach that is relevant, personalized, empathetic. And when you begin to combine that with kind of rich digital experiences for patients, there's a pretty kind of powerful way to impact people personally, but at scale. And that's the impact that we're seeing. And I tell you what, some of the promising things on this is we probably have hit about 500,000 people are actually on what we call our vaccine loops. So kind of putting them on a digital program to understand the loop, to kind of coordinate side effects and to understand them between the two doses. And we're actually seeing a 17 or 18% increase in African-American and Black populations, versus general. So the great news is we're seeing great promise when these digital tools are actually embedded with empathetic, relevant, kind of language and content. And so we think there's great promise in this, Colin. We really are seeing some terrific data early on.
So you hinted at something there, Michael, that I want to explore. You're saying that the content, you're not only just providing a straight up message, you're providing links to content and other things that talk about the vaccine, and it seems to be very targeted as well. And that's a 17% increase.
Yeah, and I guess,
amazing.
Yeah, and to just try to make it personal, any of us who have a nurse or physician in our family, when anything goes south, we of course are texting that person right away, right? And it gives us comfort and confidence in our plan of care, be it informal or formal. So the idea of GetWellNetwork and Docent together is, imagine if you had a care navigator, you put it in everybody's pocket in the world. Imagine a comfort, confidence, and adherence to the best plan and access to the best plan of care. If I literally had a nurse in my pocket who actually was knowledgeable, who knew about me, who knew kind of my particular situation and my access to care. So that's really the concept here. And we're seeing the impact on the health equity side be pretty dramatic, pretty rapidly when we actually deploy these kind of tools.
And Royal, what have you found in terms of, adding this sort of rich content that's available from GetWell to the outreach that you've traditionally been doing to patients?
Yeah, it's such a sort of no-brainer synergy, and getting out into the community, using SMS to engage, to build awareness, and then also where needed in those pockets, having the community-based advocates. And we can drive engagement into those loops, into those pathways that are going to help you make sure that you get to your vaccine, that are make sure you get your second vaccine, that can help you understand what are the symptoms that are normal versus what are symptoms that are abnormal, so you can manage your health and you can manage your care and you have that navigator in your pocket. Or if you are actually diagnosed with COVID-19 and you're positive and you're quarantining at home, here's the nurse in your pocket and the pathway to help you manage that. Everything from how are you feeling as you're quarantined and isolated from a mental health perspective, to how is your care and how are you coordinating with your care team. So doing the front end, and really driving that last mile of connectivity, and layering on some services, especially in vulnerable populations, and getting them into these loops that are extremely effective and extremely scalable is just a really powerful model.
So it sounds like so first of all, I think in general, this is just going to help with vaccinations, period. Sort of regardless of economic, social, ethnicity backgrounds, just, by educating the public and having this, nurse or doc in your pocket kind of idea. But in particular, to address what you started with, Michael, around, the Black population and Hispanic populations not having or COVID impacting them greater than other populations. How do you see this in particular as maybe so is this an opportunity to kind of build trust in healthcare? Because we've heard about that as well, that they just don't trust the healthcare system.
There is a great kind of concept and business book out many years ago called the speed of trust. And the formula is simple. When trust is high, costs go down, speed goes up. When trust is low, costs go up, speed goes down, right? It's a principle that we use inside the company from a cultural leadership communication standpoint. And it's a principle that actually matters, when it comes to digital health tools and their ability to kind of get scaled out and to touch and influence behavior, and so that I think is the really operative thing in this is sometimes we actually deploy tools that have been proven in other walks of life or society, and we try to apply them into healthcare, and it actually just misses the boat on how communities communicate around healthcare. Healthcare is personal and it's complicated, and so building that trust is hey, what voice is this actually in? What words and phrases are you actually using? How are you describing a really complicated, scary, anxiety-provoking situation in a human kind of way? And so I think that is really the essence and the core competency that both Docent and GetWellNetwork have brought together over the years we've been doing this work, which is how do you take really complicated things, do them at scale, but have it be incredibly personal. So I actually feel like you know me and that you care about me, and that's going to actually drive me to action that we know is going to be best for you. So that's really the combination, Colin. That is not easy. It's easy to say, it's hard to do. And these two companies have actually done it at scale, and it gives us a lot of kind of promise to lean in and kind of get after this thing pretty aggressively.
Yeah, and Colin, I think it's an interesting point, because I do think there's an opportunity in this. And if we look for the silver linings, like systemic racism, skepticism of healthcare has been negatively impacting people of color for generations. And there's an opportunity, and the way that we work with our health system partners is to help get their brand into the community. So it's not building a brand relationship with Docent or with GetWellNetwork. It's building a brand relationship with LifeBridge or Common Spirit. So they're building that advocacy, and they have a chance to then really be the ones who are standing up in the community saying, I'm here to help ensure that you and your grandmother and your friends are getting taken care of. And if we can use this as an opportunity, not just to improve health, but to start to change how they think about their relationship with the healthcare providers in their community, I think that's really an opportunity to start to transform some of the longer systemic biases that exist in the institution and in our culture today.
Well, that's a good segue into my next question, actually, Royal. When I talk to people in healthcare and we start getting on the topic of dealing with social determinants of health, poverty, travel, those kinds of determinants, it can be a little overwhelming for people. Like, where do I even start? I mean, that's such a big sort of societal problem. How does healthcare, how do I, as a CEO of a healthcare system, how do I even start to address that? So if I was such a CEO, and you were standing in front of me, Royal, what would you say to me? Like, hey, it's okay. Like, what would you tell me to kind of like go for it? Like, just go ahead and start, because it is sort of, like I said, it's just so overwhelming. It can be so overwhelming. What would you say to me to kind of unfreeze me to start looking at this?
Yeah, I think I would take a playbook from our partners at Common Spirit, and Lloyd Dean, the CEO, has been very vocal and outstanding, and he's got a great team of leaders, and we're working really closely with Dr. Alicia Cole and their population health team that's focused on health equities. And the first thing that we said we were going to do, and to your point, is like, where do you get started? Is, okay, let's pick a community. We are working in downtown LA. We are hiring people from the community to be advocates. We're tech enabling them. We're plugging that back into the health system. We're looking at risk scores so we can see who are the highest risk individuals, what are the highest risk communities from a social deprivation index perspective. And then we're just getting on the ground virtually to start engaging, and then building it up from there. But we're still building up the vaccine supply and the distribution network, but if you don't start with that advocacy and that engagement, you've got to start that now if we're going to have any success in this in the next year. So to your point, it's like just breaking it down, getting tactical, getting started. But I think that community sort of virtual engagement at a community level, at a neighborhood level, is really important if we're going to start to chip away at this health equities issue.
Yeah, and again, just to kind of like really bring it like to the neighborhood level, it's, you know, we're hearing about standing up all these massive vaccine sites at stadiums and stuff like that, right? Even that, while it's wonderful, it's intimidating to an older person oftentimes, right? I'm going to drive to this massive parking lot. Where am I going to kind of go? And because of COVID, I can't have my daughter or son drive me because they can't be in the car with me. So imagine, like, this is all that's actually happening, like, in the human world. And so what Royal's talking about is all of a sudden now when we reach out and it becomes, hey, we know where you live. Here's where you live. 2 blocks away, it's a quick walk down to the CVS. They're going to have vaccine on Friday. Like, this is the kind of outreach when you actually can do it at scale, but you personalize it, you know, and lean into that personalization. This is where we believe we can have the impact, and we're seeing impact kind of early on in this stuff.
So, other than calling both of your organizations, what would you recommend to someone who's in the middle of this already to try and improve, you know, their vaccination programs? Because we've heard, you know, that we've seen the stories on some of the other media outlets where, you know, it hasn't gone quite so well. There's some issues and so forth. What could they do right away without your tools to kind of improve things?
Yeah, I mean, I guess I'll just make a comment, and I'd love to, you know, Royal will have a great thought on this as well. And that is, you know, I think too often we are taking blunt objects, technology objects, from a public health standpoint, and they kind of have the opposite impact of building trust. All right, so we send a link to a government website. We ask people to download it, and we already know there is a level of distrust. You know, I think we have to, one is lean on the trusted relationships. We have a tremendously scaled healthcare provider system and network in this country, and I think the trust oftentimes lies like in those providers. You know, we look to our physicians and our nurses and our primary care offices to actually give us direction. You know, that's what we want as consumers. It gives us confidence. And so I actually think like there are ways to really like lean on that network as a trusted resource, and then add in some technologies that actually can be coming from them. It just helps us actually not deny it or delete it the first time. It helps us say like, hey, this is my doctor reaching out. This is my hospital reaching out. I trust them. Now I'm going to go here. So I think like I would really lean on, you know, this provider network as like a real trusted voice in this, and find a way to embed that into our outreach. I think is a really important thing.
Yeah, I think, Michael, that's a really good point. And one of the challenges that we've been seeing as we talk to states, as we talk to health plans, as we talk to providers that are trying to manage this, is a lot of it still feels like it is being based on call banks, where people are picking up the phone and trying to call, like either consumers are calling in to try to figure out if they're eligible and what they do, or the phone banks are calling out, but then like you're expecting someone to just be available when you make that phone call. And so we've been doing a lot of work, and I just, you know, broadly, I think this is an opportunity, but it's obviously a space that we are very involved in, is leveraging smarter technology like text messaging to get specific messages into specific people's pockets asynchronously so they can react to it when it's efficient for them, and just like bring down the cost of the outreach and the navigation for the vaccine rollout, because it's hugely labor intensive right now if you're relying on phone banks to like make those connections. And I think if we can use technology in smarter ways, we can drive and activate that network in a more personalized way that Michael's speaking to, because it's so important. We've got to do that in a way that manages the cost, but also drives a more personal connection.
Yeah, Con, now that we all are on these phones, you get these crazy text messages from people don't know you. You get these phone calls, people that don't know you. You get these links sent people that actually don't know you. So, and so to me, it's like if one more of those has to do with vaccine, but it's coming from one of that random kind of things where I don't trust it, like this is where I think the barrier lies, right? And so the tools are there. It's just sometimes I think we're taking, again, just too blunt of a technology instrument that is already lacks a little bit of trust on the consumer one-to-one level. And I think we need to find a way to kind of match those two things together. Scalable tech, but real personalized and coming from a trusted source. Like this to me is the combination that can really drive behavioral change and trust and confidence.
I like what you've said there. I mean, we have a tendency in healthcare, especially in the middle of a crisis, to use sledgehammers for everything. And sometimes that's not the best way. We actually can cause a little bit more damage or not get the results that we're all hoping to get, which in this case is shots in arms, right? So, no, I like it. I really like what both of you are doing. And actually, that brings me to my final set of questions here. I mean, I'd be remiss being a health IT publication not to ask this question, but it's a fairly recent, getting together of your two organizations between GetWell and Docent. Like, maybe talk to me a little bit about that. How did that come about? Or why is it making sense for the both of you to get together like this?
Well, I'll just start. Warren and I are always laughing. We're like, we're breaking a record as far as getting to know each other, our families, our teammates intimately kind of through these screens. It has been quite a journey, but I will tell you, at GetWellNetwork, we're working with over 200 enterprise clients across the US, Canada, Middle East, Australia. And so we've been at this for a long time, and we have a very active client community, large, complex organizations trying to solve really hard problems. And our product council, which is a group of our active clients, have been pushing us for about 6 months. They're like, listen, we love the work that we are doing when someone's in the crosshairs of their care and how GetWellNetwork's helping us. But here's the situation when it comes to things like COVID and these folks are just at their homes afraid. We need to find a way to actually reach out to them, connect with them, pull them in so they understand what their next step in the care is. And so we have been pretty actively searching for a way to kind of accelerate that need, of our large providers and their communities. And when we found Royal on the team, just the authenticity, the depth, the care, the passion and compassion for kind of what they were doing, and the outcomes were pretty remarkable to us. And so we kind of latched on pretty quickly and just held on to their ankles as they were like racing as fast as they could to have impact. And so we're just thrilled to have a chance to partner up with Royal as a person, and his team is just incredible. So I'll let him comment, but that's kind of how it is that this all came to be.
Yeah, it's been really exciting for us. 2020 has been an unexpected year in a lot of ways, but for Docent, we've been really fortunate to have some significant growth opportunities in front of us. But one of the things that we realized is just taking a step back and looking at the market. We needed to get much bigger, much faster, markets consolidating. And when we started talking to GetWellNetwork, it was just such an obvious synergy in terms of the product roadmap, the commercial connections that we had to be able to put solutions together that were going to be higher value partnerships for these large complex institutions where there's like too many vendors that they're working with, there's too much fragmentation, and they want partners that are helping them manage holistically across a consumer, across a patient lifetime. And so the ability to just scale and go much faster with a strategic partner and build in all of the 260 pathways that GetWellNetwork has built, and the digital tools, and plug in the Docent capabilities on the front end is just, it felt like a really exciting opportunity to accelerate what we were doing. And yeah, it's been an interesting start to the year as we're all kind of merging through Zoom, but it's been a really, really great ride. And couldn't be more happy with just the cultural fit and the mission and the values. So yeah, we're really excited.
How was that going through an acquisition during COVID? I mean, not being able to literally reach across the table and shake hands and those kinds of things. What was different about it?
Well, I will tell you, there's this, of course, this famous business quote that culture eats strategy for breakfast. Well, I'll tell you, we have a little bit of a different take on this. We at Get Well Network, we believe that, values sit at the dinner table. I mean, literally. And so one thing that, Royal and I talked a lot about very candidly and openly from the very outset was, let's kind of start with values. What do we actually truly value in our personal lives and our professional lives? Because these things have gotten so blended, and both the Docent culture and community and the Get Well culture and community has quite purposely blended these things. And so I think for us, and I don't mean to be so sound esoteric, but it really does for us. It was, hey, values sit at the dinner table. Let's actually talk about them first. Let's figure out this actually is aligned. And when that stuff gets aligned, the other stuff, it's not easy. But I will tell you, like when the hard things come up and you just double down on the values, the decisions become pretty clear to you, and that's really where this whole thing really kind of rests, and it makes it pretty straightforward for us and pretty exciting.
Awesome. My final question, where can people find out more information about both your organizations? Where should they go?
Yeah, so certainly, GetWellNetwork.com. Obviously, I'm on Twitter at GetWellCEO. And of course, we're on LinkedIn and all kinds of crazy places where we show up.
I was going to ask, so do you have a TikTok? Is that in the works there, Michael?
I got 2 teenage girls at the house. So yeah, like we're a TikTok family. I try to every once in a while, for me, but they're all over it, of course.
And Royal, how about you? Where can people go to find out more information about Docent Health?
Yeah, docenthealth.com. Obviously LinkedIn, very active, Twitter as well. And obviously excited that people are going to be able to go to Healthcare IT today and connect with Colin and hear a little bit more about what we're doing.
Well, thank you for that reverse plug. I really appreciate it. And thank you to both of you for taking the time today to sit down with me. This has been great. I mean, we started by talking about vaccine inequities. We ended up talking about culture and values. This has been a fantastic conversation. Thank you so much to both of you for your time today.
Hey, thank you. Thanks for what you do.
Thanks, Colin.
This has been Colin Hung with Healthcare IT Today. Thanks for listening.